Hi folks, welcome to my channel, The Average Dermadoc. Let's begin the show. Clofazimine. What is clofazimine? It is a synthetic riminophenoxine dye derivative. This riminophenoxine dye will have a red to orange color. Hence, this drug clofazimine is also red in color. Coming to its pharmacology, it is available in syrup and capsule formulations. 50 mg, 100 mg and 300 mg capsules. Why it is not available in tablets? First we will see what is the difference between a capsule and a tablet. Tablet is a very solid hard drug. It can be easily split into exactly two halves and we can divide the dosage into half. But capsule is a lipophilic, oily, powdery drugs which is covered in a soft gelatin capsule. If the drug is having a bad taste or odor, this capsule will cover it up. Hence, for those drugs, capsules are used as a formulation. Coming to the answer, why clofazimine is here only available in capsule? It is highly lipophilic in nature. If it is provided in capsule formulation, it will enhance the absorption, and clofazimine is bitter in taste. To cover the taste, it is available in capsules. If you want to try its taste, you have to break the capsule and taste the drug. Coming to its oral bioavailability, 20 to 70%, and it reaches its peak in 1 to 6 hours. This oral absorption increases when taken along with food. As it is highly lipophilic, it gets concentrated in lipid-rich tissues, mainly reticuloendothelial system. Some of the drug also gets deposited in breast, liver, intestine. Hence, its T-half is very long, 70 days. It is metabolized in liver and excreted through liver only in the form of bile and feces. A very minute amounts are excreted through urine, tears, milk, sweat, sebum and sputum. Hence, all the secretions will give a color of reddish brown, as the drug is a colorful dye derivative. Coming to its mechanism of action, it has only two mechanism of actions, both antibacterial and anti-inflammatory. It increases reactive oxygen species levels and acts as a weak bactericidal drug. It also inhibits DNA replication by binding to guanine. Coming to its anti-inflammatory action, which is mainly used in type 2 lepra reaction, it inhibits neutrophil chemotaxis. US FDA-approved uses. It is a most active antimycobacterial drug against TB, leprae, Mycobacterium avium intracellular complex. It is also useful in type 2 lepra reaction. Coming to its dosages, I have already clearly did one shot and uploaded in my channel about multidrug therapy in leprosy. In adults, 300 mg monthly once supervised dose will be given. Apart from that day, remaining all days, 50 mg daily. For children in between 10 to 14 years of age, exactly half the dosages, 150 mg and 50 mg on alternate days. As I have already told you, capsule can't be broken into two halves. So, same dose 50 mg will be given as an alternative on alternate days. As there is no 25 mg capsule formulations available for type 2 lepra reactions, we will start with 300 mg and we will reduce the dosages. Coming to off-label uses, pyoderma gangrenosum, chronic cutaneous lupus erythematosus. Clofazimine is seldom used as a solitary agent, but most often used with other antibacterial and anti-inflammatory drugs. What is the meaning of seldom? It is rare or occasionally. Clofazimine is rarely or occasionally used as a single drug. Most often means commonly, frequently it is used with other antibacterial or anti-inflammatory drugs. As it has very less drug interactions, it has an added advantage to add in multidrug therapy for TB, multidrug therapy for leprosy. Coming to its adverse effects, as you already know, it is a colorful dye derivative. It gives reversible orange to brown pigmentation to skin, conjunctiva, and all the other secretions. It is reversible. After stopping this drug, within few weeks, the color will come to normalcy. It also stimulates melanosis, hypermelanosis. Hence, it will give nail black color, melanonychia. It causes xerosis, which may lead to ichthyosis. GI disturbances like nausea, diarrhea, and abdominal pain. And crystals of this drug will get deposited in intestine and may cause fatal enteropathy also. It is rare. Crystal deposition in various viscera and conjunctiva, electrolyte imbalance. Rare side effects like cardiotoxicity, dysarrhythmias, splenic infarct, eosinophilic enteritis. What we have to monitor while giving this drug, we have to check baseline electrolytes as it causes electrolyte imbalance, and LFT as it gets deposited in LFT, metabolized in LFT, eliminated through liver only. Contraindications. Absolute contraindication for any drug is hypersensitivity, common sense. Then relative contraindication, pregnancy, lactation, pre-existing liver and electrolyte abnormalities have to be checked, and then only we have to start. If liver abnormality is there, we have to adjust the dose and then we have to start the drug. It is a category C drug. C for clofazimine, C for category C drug. Remember the channel name, The Average Derma Doc. Don't forget to like, share and subscribe. Thank you. Hasta la vista. До свидания.